All right. Well, good morning. I know we're running a little bit behind, so I'm going to try to be short but sweet in a number of slides. I will tell you that traditionally when I present slides, there is a lot of information, mainly for your viewing pleasure later on, and I'll talk about the salient features. But today's talk is about targeted assessment for prevention, or TAP for C. diff, which is from the CDC. I'm Dr. Cindy Hou. And each of these is different sections. First off, in case you have never heard of TAP, this is the Targeted Assessment for Prevention. And basically, it involves a series of quality improvement initiatives, along with partnering with your infection preventionists and infection control officer, epidemiologists, and the like. And really, it exists for 3 different entities, including catheter-associated urinary tract infections, CAUTI, CDI, which is for C. diff, and CLABSI, which is central line-associated bloodstream infection. And target is we try to find the facilities and the units that have excess infections so that you can then target those for interventions. Assess is really looking at gaps and opportunities, and that's something that we're currently looking at. And then prevent is based on the assessment results, what are the tools and resources that you can use for interventions. The CDC has lots of different links. I will say that they have posted different materials onto YouTube, such as the technicalities that have to deal with looking at National Healthcare Surveillance Network, or NHSN, descriptions of how to kind of go into different sections, and it gets very technical. And that's why I've just provided some of the links here, and they refer to videos from 2019. So the first section is target in the TAP, and just to set a baseline of different definitions that this relies on, but essentially this first part is you're just trying to see which units are more vulnerable. In case you've never heard of CAD, which is cumulative attributable difference, this is a number of infections that must be prevented within a group, facility, or unit to figure out what your HAI reduction goal is. And the way this is calculated is you subtract what is your prevention target from the actual observed number of healthcare-associated infections. And so CAD is an important part of this section. SIR is also an important term to know, and this is the what is tracked at a location, facility, or group level, and you have your observed infections over your predicted infections. And generally speaking, if an SIR is more than 1, that means you're having too many infections. Of course, we want to have 0, but these days it's very competitive, and not just that, but we want to prevent infections. So it is generally considered good if your SIR is less than 1, but why be good when you can be great? So if you can target an SIR of even lower, that's greater because there's fewer infections. And as I said, this is like very technical, but I just wanted to have screenshots and then tell you what it entails. So when you go into NHSN, you can generate what's called a CDI TAP report. And it just shows you screenshots. I said you can go to the YouTube videos to see the technicalities, and then you run a report, and then you can modify at different levels. Lastly, the meaty part of this is it generates a sample output report. And I know it's really tiny, but what you're looking at is you sort of say, okay, this is the target of what I want my goal to be, and then it calculates what your CAD would be and how many infections you would need to get down to that target level. There are some institutions that you might already be able to calculate the CAD on your own without this tool, but it is a good output report to review. Okay, so the second section in TAP is assess. And this has many different areas that you have to begin to think about before you actually do the survey assessment. For instance, where are you going to do it? Is it all of your hospitals or certain units? Who's going to be completing these surveys or assessments? What's your timeline? How are you going to deploy? Are you going to have various meetings, or a meeting about a meeting, or an email? And then you have to write an email about what this is to gain buy-in. And of course, gaining buy-in is one of the most important ones, whether you gain nursing or physician buy-in. You did identify champions and more. And there's a whole process of collecting the assessments, kind of encouraging people, if the total number of respondents is not as high as you think, then a subsequent reminder. So the CDC provides a TAP facility assessment deployment packet because what can be customized are, for instance, the names of the units you have. So for instance, if your ICU is something random like ICU South or something, then it could be tailored compared to your ICU North and all of that. I will say that some of the historical documents on the CDC mention SurveyMonkey. I believe they don't have that any longer, but they do have MS Forms, which is a Microsoft tool. It also gives you an idea of what the email might say when you're trying to convince other people to do your survey assessments for free. It's not very time intensive. It's about 10 minutes to take. And the whole point is to have a wide array of people take the assessment and not just kind of the people who are knowledgeable about C. diff. We want the staff physicians, the staff nurses, and so forth. And what is also really nice is the different surveys come in English or Spanish, and that's called the facility assessment tool. If you wanted to do a deep dive for the infection preventionist, then you could, there's a link for that, versus for environmental services, they might have different surveys compared to what the lab might ask about. And what's also nice, it's provided in English and in Spanish. These are very tiny, but the next several slides detail what the actual assessment looks like. So this comes from the PDF version, but of course it'll look very different if it's on your phone or whatnot. And so this is called the TAP Facility Assessment Tool for CDI. This is a form that we have recently been working on. And you have to name your facility, the unit name, kind of the names, as I said, could be customized. Next, it talks about general infrastructure, capacity, and processes. So there's lots and lots of questions, yes, no, or unknown, as far as engagement with senior leadership. Hand hygiene, PPE, and contact precautions is really very high. And the knowledge is to anyone, right? Because maybe you're already doing this, but then somebody had no idea. So that's an opportunity to prevent C. diff. Auditing is something that may or may not be done for hand hygiene, PPE, contact precautions, and environmental cleaning. Antibiotic stewardship, we know that is a critical part behind risk factors for C. diff. And it's possible that people don't know that this exists within your institution, but do you monitor high-risk C. diff antibiotics or reduce unnecessary antibiotics? Interestingly, there are a number of questions regarding nursing's role in antimicrobial stewardship, which are secret weapons because they could be engaged in taking allergies. They could first notify a physician if there are adverse events such as rashes. Then there's early detection and isolation appropriate testing. There's a lot about diagnostic stewardship, especially not to test when there are laxatives, when contact isolation is deployed. And then do you do case review? Do you communicate, talk to each other when you're transferring in the facility or from or within the facility, such as to different radiology units? And it goes more into contact precautions and hand hygiene, asking questions such as the duration of contact precautions. If you cohort in times of high volume, for instance, do you have dedicated equipment for people with C. diff? And there are also many questions asked of the patients if they're engaged with, for instance, bathing, showering with soap and water every day. The hand hygiene at different times is also very critical. For EVS, do you clean high-touch surfaces and who cleans what? Also, for environmental cleaning, it's important to know what are disinfectants versus what is sporicidal. And the last section is prevention. So imagine that you get these survey results. I would just tell you that this whole entity of the survey assessment is completely free. Like these days, oh my goodness, like free? Are you kidding? So and not only that, but the individuals at CDC who are engaged in this also provide free advice over Zoom meetings. And so you get all this data and then you have to prioritize what to do. And it gives sample templates of who might be doing what, how would you prioritize if there's gaps in all these different places. It's really quite nice. And then last but not least, there's various toolkits. So for instance, it's very much engaged with quality improvement because now that you've had the opportunities, well, what are you going to do about that? Well, you're going to prioritize, such as in this matrix here, if it's low hanging fruit and it could be very feasible, well, that's a no-brainer that we should all be doing. So it provides items like a project charter, practice analysis tool, implementation plan, kind of PDSA cycle, small tests of change, the strategy grid, and more. And so it's really a very nice free package. Of course, like your institution would have to consider all of these different factors. There's also many resources, and there is a email address of HAI prevention@cdc.org that is in one of these slides that I have, because they're alive and well and back in service if anyone wants to do this for free. Of course, you have to engage with your infection preventionists. On that note, I will end and ask if there are any dying questions or comments.
I don't know if they're dying. We do only have one so far, which is when to test for C. diff. Can you hear me, Cindy?
Okay, I see there's a comment from Valerie Guerrero Hanel. Thank you for the great presentation. Thank you for the shout out. And I think there was a question of when to test for C. diff. I don't know if that's an old question, but that's for, as clinically indicated, when people had 3 or more loose stools, the right setting and more.